Good afternoon and welcome to Let's Chat with Dr. Celeste MD. I'm your host, Dr. Celeste Reese-Willis. I am your board-certified family medicine physician. I assist busy professionals to find solutions for both their acute and chronic medical needs. We do this through primary care, telemedicine, concierge medicine, COVID-19 testing, COVID-19 vaccines, through our Amazon best-selling book Vitality, and as well as each Monday morning during our 6:30 a.m. house call segment on CBS 42 News. So good afternoon, ladies and gentlemen. Welcome to Let's Chat. Today's topic is psoriasis. August is National Psoriasis Month, and for that reason, we like to bring attention to a topic for us to discuss it, kind of talk about it a little bit, find out if this applies to you. This may be helpful for you. It may be helpful for someone that you love or a friend. So let's just get right into it. Today, we're going to share with you, though, 4 tips that you can follow to avoid a flare of psoriasis. So first, let's just talk about it. What is psoriasis? It's a disease process that affects about 3 million Americans in the United States each year. The most common age group is 18 to 35 years old. That's a typical age group. When people present, you can actually present at younger ages and older ages, though. That's just the average, the 18 to 35 years old. So what is it? Psoriasis presents as a scaly, itchy rash that appears typically in patches, sometimes red patches. In kids, sometimes it can be a small little scaling spot that you find on their skin. They may complain of itching, burning type lesions that are sore. So what triggers it? What is it that typically triggers psoriasis? So there's several different things that can trigger it. One of the things that we know is that if you have family history of psoriasis, you are sometimes more likely to develop psoriasis and have flares. So in addition to that, you can get triggers for psoriasis like a bacterial, fungal, or viral infection. In addition to that, stress can cause you to have a flare of psoriasis. Injury to your skin, being overweight, smoking, as well as alcohol abuse. All of those are triggers for psoriasis. And again, that's bacterial, viral, or fungal infections. Injury to your skin, stress, obesity, smoking, as well as alcohol abuse. So how do we diagnose it? You'll go into the doctor if you have a rash, show it to them, and at that point, they'll perform a physical exam. They'll go through your family history. They will sometimes obtain blood work like a CBC or complete blood count. It tells us different cell level types that we look at. In addition to that, they may do what's called a skin biopsy, where they'll take a little piece of the rash of your skin and send it off to a pathologist who will look at it under a microscope to see if the skin changes, the dermal layers of skin, have changes that are consistent with psoriasis. So that's how we diagnose it. So what do we do to treat it? Okay. Several different kinds of treatment. How bad your particular cases will determine typically what is used for treatment. Treatment can vary from having light therapy to having immunosuppressant drugs that suppress the immune system so that you're not triggered to have a flare of the psoriasis. In addition to that, there are topical medications that are used to help decrease inflammation, as well as analog treatments or medications that are analogs of vitamin D. Okay? So if you had, and I want to make sure that we stress this, if you have family history of psoriasis, that does unfortunately increase your likelihood of having it. Okay, so now let's hit these 4 tips that you can follow to prevent psoriasis flares if you have psoriasis. Now, and if you have family history, and if you see a rash that's kind of scaly in nature, ask the person that's the person in your family that has it, to make sure or show you what it looks like on them or what it's looked like on them, if that's possible, so that you can find out, hey, is this something that I need to have checked out? Now, those 4 tips for prevention, this will not surprise you. And it's so interesting that a lot of the things that we recommend that you do to prevent a lot of disease processes are shared with different disease processes. So you're going to find that here in some of these tips. So number 1, make sure you eat a good balanced diet. Lots of fruit, lots of vegetables, lean protein, and whole grains are very good. in helping to prevent psoriasis. Number two, we need to know the triggers. Know what triggers your psoriasis and avoid them, okay? So if you know that something in particular stresses you out, and every single time you deal with this particular situation or person or thing, then try to avoid that if you can. Sometimes we can avoid it, sometimes we can't, but if you can avoid the trigger, that is the best thing. For example, there's certain kind of medicines, antibiotics in particular for some patients, that they've reported that trigger them to have a flare of their psoriasis. So you want to know the trigger and avoid it, okay? That's number two. Number three, we're going to avoid stress. Avoid stress. Now, there are different things that we can do to help decrease stress or help us deal with stress, and that's what you want to do here. Meditate. Meditation, prayer, very, very, very beneficial in helping to avoid or decrease stress levels. In addition to that, one of my favorites, exercise. Exercise is something that helps prevent psoriasis via helping you to avoid stress. And it also ties into our fourth tip. I'll go on more about that in just a moment. And in addition to that, another way to help avoid your stress is to channel it, whether it be that you're someone that enjoys painting or enjoys fishing or enjoys, taking a walk in the park, aerobics, whatever it is, playing with the kiddos. Anything that will help you to decrease your stress level will help to prevent a psoriasis flare. Number four, fourth tip, avoid infection. So what things can we do to avoid infections? We know that we can drink plenty of water and exercise. Those are things that help to support our immune system. In addition to that, we want to make sure that we're following and doing everything we can to avoid infection. That would include and not be limited to making sure that you're caught up on your immunizations. August is also Immunization Awareness Month. The CDC has it every August, is that time of year. And most of the time we think about kids more so, right? And making sure that they're caught up on their immunizations as they get ready to start school. So we want to make sure that we do that, and remembering that the purpose of these vaccinations is to prevent illness and disease. And they've done a great, great job of doing that. So we want to make sure that we do not miss any vaccinations. I know in the last year since the COVID pandemic has begun, a lot of us have not had our typical annual exams, which I want to take a moment here and say, if you have not, please make sure that you have seen your physician in the last year, your primary care physician, so that you can make sure that you're good on all fronts, whether it be if you have a history of hypertension, diabetes, heart disease, high cholesterol, asthma, COPD, any kind of illness. There may be screening tests and things that we typically run on you each year. We want to make sure that you don't forget those and that you don't lose sight of those during this pandemic, to make sure that there's not something that needs to be addressed that leaves you vulnerable to infection. And so that's our point with that. So other than that, we're going to make sure we're caught up on our immunizations. If you are out there and you are not vaccinated for COVID-19 and you are 12 years of age or older, I encourage you to consider going ahead and being vaccinated, especially with the rising rates of the Delta variant being throughout the country, as well as recently knowing that the Lambda variant in recent weeks has entered into the United States. So I want to make sure everyone that can be vaccinated is vaccinated, and they have that conversation with their primary care physician. Other than that, washing hands and being socially distant is definitely recommended. Remember the tools that we used in this last war, in this last year of the war that we've been fighting with COVID. Don't forget your artillery. One part of our artillery is what? Our mask, right? One part of our artillery is the vaccine. The other part is making sure that we're washing our hands and being socially distanced, and that we're cognizant of what's going on around us when we leave our home. And when I say that, I mean be cognizant of the fact that if you live in the state of Alabama, we are in a high transmission state with the Delta variant, with having high numbers of it circulating throughout our state. So again, just want to review here those 4 tips to help us avoid a psoriasis flare: eating a good balanced diet full of fruits, vegetables, lean protein, and whole grains. And then number 2, we're going to know what our triggers are for the psoriasis and try to avoid those, whether it's medication, whether it's bacterial or fungal infections, whether it's stress, etc. Number 3, avoid stress. Learn how to channel it, whether through meditation, exercise, prayer, whatever way it is that you're able to channel that. Painting, some people take a long walk. Everyone has a different, some people have a song that they go to or they play that immediately helps them to calm down and avoid that fight and flight response that occurs when we get stressed out and we get those hormones running. Okay, number 4, avoid infections. And we do that by following a balanced diet, water, and exercise. So that's all I had to share with you guys today. Thank you so much for joining in. Hi, Miss Jones from Greenville. How are you? Thank you for joining. Hi, Pretty Barbie. How are you? And Miss Shepherd, how are you? Do you guys have any questions about anything? Any medical questions at all? I want to say also, if you do have any medical questions, I do want to invite everyone to tune in to House Calls with CBS 42 News every Monday morning at 6:30 a.m. Yours truly. We are bringing you a segment on trying to help keep everyone healthy. And so we have that every Monday morning at 6:30 a.m. CBS 42 News. We will post the link. We usually post that every week so that if you miss it, you'll be able to catch that. So, and with that segment, we actually will answer any of your medical questions. So you can email us at housecalls@cbs42.com. Again, housecalls@cbs42.com. Please send us any medical questions that you have. Does not matter what it's in relation to. Anyone have any other questions? I know it's short and sweet today. Just wanted to share something that we hoped will be helpful. Okay, so that's all I had to share, guys. Again, join us tomorrow morning at 6:30 a.m. if you're in need of COVID-19 testing in the Birmingham or surrounding area and or COVID-19 vaccinations. We have Pfizer as well as Johnson & Johnson. You can give us a call for an appointment at 205-291-8842. That's all I had to share today. I hope you guys will have a great Sunday. Please be safe if you leave your home. Sunscreen, but get some vitamin D by spending some time in the sun and get that vitamin D. Okay, have a good Sunday. Bye-bye.